Let's discuss about primary ciliary dyskinesia and cystic fibrosis. In primary ciliary dyskinesia and cystic fibrosis, one of the common cause of bronchiectasis. In primary ciliary dyskinesia, there is problem in the dining arm defect, abnormal ciliary motion, and impaired mucociliary clearance. And in cystic fibrosis, there is mutation in the WAR CFTR gene mutation. In cystic fibrosis, there is CFTR gene mutation, and there is impaired ion transport. If we look at the respiratory symptoms in both cases, there is bronchiectasis, there is sinopulmonary infection in both cases. There is nasal polyp, and both cases there is digital clubbing. But if you look at the extra pulmonary feature, in both cases there is infertility. In primary ciliary dyskinesia, infertility due to immotile spermatozoa. There is situs inversus in 50% of the cases. In primary ciliary dyskinesia, there is normal growth. But in cystic fibrosis, extrapulmonary features are pancreatic insufficiency, infertility due to absence of vas deferens, azoospermia, and failure to thrive. In primary ciliary dyskinesia, there is normal growth. In cystic fibrosis, there is failure to thrive. In primary ciliary dyskinesia, there is low nasal nitric oxide level, bronchoscopy and electron microscopic visualization of the ciliary abnormality, and genetic testing should be done. And in cystic fibrosis, there is elevated sweat chloride level, abnormal nasal transepithelial potential difference, and genetic testing. So if we look at the diagnosis again, low nasal nitric oxide level in PCD, primary ciliary dyskinesia. In cystic fibrosis, there is elevated sweat chloride level. In both cases, genetic testing should be done.